Hit it.
Welcome back to Blame Anesthesia podcast. I'm Melissa.
I'm Stephanie.
I'm Andy.
Jimmy.
Should we do a cheers?
Cheers.
Cheers.
I'm glad Jimmy learned how to take a drink after the cheers. That was really uncomfortable.
I thought you were going to do that with a straw.
Starting an episode's always fucking awkward.
No, it's not. I think it's pretty fun. We start off with a cheers.
I don't know, because I'm always drinking beer, so it's like,
Cheers.
Well, yeah.
am I supposed to do it when I'm cheering? I don't know.
Who wants to bring up the first topic?
We're gonna
Stephanie.
Stephanie,
Your turn.
your turn.
Should we
Lights
talk
on
about
you.
what we just saw on Instagram?
With the LMA?
Yes, with the LMA from, what was it, Anesthesia God?
Anesthesia
Okay.
guy.
Did you guys see that video?
Yeah, poor guy's throat was...
So if you didn't see it, this video basically someone is putting in an LMA and they just corkscrew it in, basically.
Well, let's explain it a little bit better than that.
You're right. It's not an
They
eye
put it in backwards. So they put it
Yes.
in with the opposite way. I don't know.
Yeah.
Can I
They-
interject for 1 second?
No. They put it in. They put it in with the aperture bars facing
Damn.
the top of the person's mouth, not the
Instead of
cord.
like this.
And as they passed the tongue, they twisted it 180. Now
Every
you can
time-
interject.
Every time I go to put an LMA, I swear I hold it for 1 second and think, which way does this go?
I do too, because I don't know.
I don't know why. Like, I know.
I don't know how I like to put them in.
I know, but for some reason you
stare
hold
at
it and
him.
it's like, it's this way, it's this way, this way.
It goes this way, I think. It's just... it
The
helps
blade,
time.
I figured out which way.
You know, all those
Can you
funny fucking memes of people holding the blade. Oh, I saw one today. It was like somebody had their fucking forearm on the patient's face trying to intubate. I was like, yo, what the fuck are you doing?
One of our dogs had to have surgery last year, and we were talking to the vet about how they intubate dogs, and they intubate them on their bellies. So the dog's prone, and they basically just go the opposite way, and they pull down and put the tube in.
Yeah, because I asked them, and they're like, "What do you think?" We lay them flat, and their dog
We're
legs
like-
are just up in the air.
Yeah, the fuck?
That's how we do people.
Why can't
Their
you
arms
do that?
are up like this.
Yeah. No, but they get like a Miller blade and they put it in and they hold it upside down and they pull down.
Can we just say that one more time? They get what blade?
The Miller blade. They
We
don't
should do
use
a
Mac
count.
blades in
Mac
dogs.
blade.
Steph and I should do a count of how many times they say Miller during this
Yeah,
podcast.
it's a cult.
Miller boys.
Yeah, we're better than you.
way better. If you
So-
use a Mac, you're whack.
Okay, so what do we think about that LMA placement technique?
So I remember the comments were 50-50. It was more like, that guy's epiglottis is never going to work again. Or, I did this last week. It works perfect. It was very split.
Oh, oof. I
Well,
was
I've
like,
seen
that
it done
throat
that way
was
before, and I
fucked.
thought like I had to stop the person. I'm like, I think you're doing it wrong. They're like, oh no, I've done this before. I'm like, oh okay, but the person struggled and how to do it.
I
You're like,
mean,
let me
like the
show you
correct
the right
way.
way.
have you
and then-
ever not struggled putting in an LMA?
Oh,
though?
yeah.
Oh,
I
the fucking
never put the, like, dude,
so
actually,
it's a tip.
yeah. I had
The tip.
It's always.
I was doing a Mac the other day on somebody that I knew this was a bad idea. I was like, I had an LMA out, as I do if I'm, well, always, but I knew I was going to be putting this LMA in throughout the case. And it went in easy as fuck. And he was humongous. And it's like, what?
You were so impressed with
Yeah,
your skills.
but then I'll have like somebody that is
Yeah.
tiny, great mouth opening, and I can't fucking get the
And
LMA
you're
to
like,
go in their
what the
goddamn
fuck
mouth.
is wrong with you?
Yeah.
But you know what? I rarely ever use LMA size 3.
I
Rarely.
never used
You know,
it.
I used
Ever.
it one fucking time. One time. I don't know why. It was like
Small
it
person.
was so. Oh no. Yeah.
I don't know why.
No.
They were small.
Well,
Maybe
person.
their
you're
weight
right.
was under
Tiny.
50 kilos, and it was indicated.
I used to do that. I used
Small
to look
mouth
at the.
opening?
I used to I used to look at the weight, and I'm like, oh, this person
I
should
always
get this
look
one.
at
This
the
one.
weight.
I actually stopped doing
But
that.
now I'm doing a 4 for everyone.
I just look at the
Mostly.
mouth opening, but that person's mouth opening was really small. I tried to put a 4 in, and
Who
it was
cares,
not
dude?
fucking working.
It's not about the mouth opening.
You're right.
No,
Just
it
get the
literally
LMA
is.
in. It literally is.
I had this big
Dude,
guy the other
yeah.
day, and I had a 5 out, and I could not. I ended up just deflating it, but it wasn't smooth at all. And I was like, a 4 probably would have been perfect.
No,
I
it wouldn't
can't-
have worked.
Surprised.
5
Disagree.
is always the way. So that was another topic. I put the biggest fucking LMA I can get in, because just because you can get a 4 in doesn't mean it's going to work worth the shit.
Yeah, sometimes I have a leak,
Yeah.
but
So put a 5 in.
It's a doable leak.
If I have a
Yeah,
leak,
it's
I
not
just
a bad
stuff
tidal
gauze
volume.
in the mouth. Is that
That's
wrong?
another trick. No.
If they're
That's
Is there
Simple
anything
tricks.
wrong in anesthesia?
No,
There's so
as
many
long
ways
as the
to do
patient's
it.
alive
Yeah, as long
and you
as
do,
you have good
you
tidal
do your
volumes or
best.
anything, whatever.
You do your best.
I never had a lesson in school. I don't remember reading anywhere how to put an LMA in. You just learn in clinical and you see 500 ways and then you're like, I like that one.
Yeah.
Or if you're
Nobody-
Andy. No, you saw the way that you do it. You didn't make that up. The from the side.
Oh no, I
Yeah.
learned it from an old school anesthesiologist.
So Andy doesn't put LMAs in like anybody else.
Like
Not
a
like what we're
normal
talking
person.
about
He
at all.
fucking
Special.
He kicks the circulator out
They
of
move
the
out
way.
the way.
No, it's so
Yeah.
You could probably teach them how to do it from
Yeah.
the side so you
dude,
have to move.
it's actually really funny.
He
'cause
kicks
it's
the
so true.
circulator out of the way and he walks to the patient's side.
It has to be
completely
the
away
left.
from the ventilator.
It has
Like,
to be
where are
the
you going?
left side, dude.
Where are
It-
you going?
It has to be the left side because I tried to do it on the right side the other day and I was like looking kind of fucking dumb and I was like going like this. But yeah, you got to go to the left side and then you just do this little motion like that and it just sits perfect every single time. I don't have to fucking deflate. I don't have to
Explained
inflate.
it terribly.
Oh no,
So,
it's great, dude.
Instead of being at the patient's head,
Oh, yeah.
he goes to the side so he can go this way, like the patient's
yeah,
head
instead of
right
being
here,
here
and he
and the
puts it in
patient's here.
from here, and then he walks back around to the anesthesia machine.
I look
Are
pretty
you doing
fucking,
circles around that?
I look fucking cool doing it. That's
I
what
don't
I'm
know.
just
I
saying.
wonder
That's
if
what
we
he
could
thinks.
somehow get like a prop bed so we
Yeah.
can just do some.
a fucking
little visual.
mannequin,
Yeah,
and
and
then
a
we could show you.
mannequin.
Hell
Yeah.
yeah,
A little
fucking
visual.
tips and tricks how to put in an LMA by Andy.
I recently found out that one of the videos, so there's all these memes coming out where like firefighters are just shoving LMAs in their mouth and they're like, bet that's not the first time that happened. You know, I recently found out that one of those very viral videos is somebody we know that put the glide scope in and DL'd themselves.
Did he know this?
She doesn't even know who I'm talking about.
Oh, wait.
Oh, I don't know.
If
You've
you're
seen
out
someone-
there, I fucking know it was you.
Is it someone we work with?
It sure is.
Oh,
They were-
they
no,
put it
no,
on
it was a
themselves?
Not a-
student.
Do they-
While
oh.
we were a student.
I was gonna say, do they go to Discovery Cove often?
No, it was not him. It wasn't a firefighter. he's a CRNA now.
Oh,
but he was
okay.
an SRNA
Wait,
with us.
you said they put it on themselves?
Yeah.
So you see all these
A
videos
demonstration?
where people are just like putting LMAs in themselves, or
Wait,
they're getting
does
a
this
glide
person work
scope.
with the wife?
No,
No, because there's I don't know, there's a video going on Instagram where I see a couple. It's supposedly a couple that goes around showing how to put an LMA in, and the guy demonstrates how to put the LMA on himself.
Do they put it sideways? Because if not, it's
No,
wrong.
but either way, putting one in on yourself.
To be honest, I wouldn't
fucking
even want one
talented. It's
when I'm
talent.
anesthetized. It doesn't look nice.
yeah.
Don't
That shit-
fucking do it. What are you
Dude,
doing?
Your
Why?
fucking throat
Yeah.
is like this big. Looks like a fucking frog.
Yeah, there's videos of people asleep getting LMAs. Why are you doing it to yourself?
Oh, yeah.
Nobody needs to see that.
I don't know.
You're not cool.
Yeah.
It seems like
Yeah.
they fucking
No,
enjoy it.
because the thing is, there's also people out there intubating themselves with the fiber optic. Now, if you're a man, that's what you do. All right. Just put an LMA in. All right, you got no gag reflex. There's all the jokes for that. So,
So yeah,
pause.
that's what men do.
Yeah, that's a man. All right. That's all I got. On to the next. You're
Next.
stupid.
Oh, Chippy's back.
Chippy's back. So I know we talked about earlier too. We were thinking of the things that we really love and hate about anesthesia and being a CRNA.
I love anesthesia.
Yeah, a lot of great things. I'll let Andy talk about the things that he likes.
Breaks.
Break. Yeah, breaks.
Dude, we get morning break. We get lunch break.
Sometimes a dinner break.
We get
yet-
dinner break.
And it's not enough. We
Yeah.
need more fucking breaks.
I'm still upset.
You need a break for
I
your
want
break.
I want people
We're
to
gonna
be
make
like
that a merch shirt. We need more breaks.
exactly. I want somebody to be like, "What the fuck? You guys are going on a break again?" No. Oh, Chippy.
Oh,
Chippy
surgeons will
break.
say that when it's just one break. Well, okay.
But I will say, if you take too long of a break, fuck you.
Well,
Yeah.
well, I think it depends. Like, if you give me one of these, like, "Yo, Jimmy, I'm sorry, bud. Is it okay if I get like another 5 minutes, 10 minutes?" I think that's okay.
If you ask, but if it's morning break and you take 30 and we didn't discuss that you were going to
yeah,
take
that's
30,
not nice.
I don't want to give you breaks
That's
anymore.
not nice. even though the other day I gave Jimmy a break, and thank God he came in just in time. I was like waking up the patient. I see Jimmy. I was like, thank God, midway, and he made it on time. I don't care. I never really check. I'm just like, it is what it is, you know.
It's
take your
more
time.
when,
but it's more like a.
It's basically when I have to pee and I came to your room because I'm like, I could hold it for 15 more minutes to give you a break, and you take 30. I'm upset. That's all I have
You're
to
like,
say.
put on some fucking gloves. We're fighting.
Being a break bitch is kind of the worst. So if we're talking about things we love and hate, I hate being break bitch.
Yeah.
I'll throw that out there.
But I love when it's here and he's like, take your time, bud. Even though I put it on my fucking Apple Watch. I'm like 15 minutes and I try to get there 15 minutes because I don't know. I just feel like, you know, just to be kind. But yeah.
Yeah.
Come look out for me. And it doesn't have to be lunch, you know.
Okay. So breaks are sick.
Breaks are fucking sick.
Having a great team in the OR, a great circulator,
circulator.
and a great tech,
Oh,
a great
my
doc,
God.
great
You could have the
surgeon.
worst case and it just makes your day
If
better.
you have that
team's good.
a circulator that plays fucking dope ass music, that fucking connects your patient to the fucking monitor.
Say Andy's
the
trained all of them
patient-
to connect the patient.
Oh yeah, and then you know it's so funny. I started.
They don't do it for me.
Well, they don't like you. You have to butter them up. So some of them though, I actually started. So at our facility, sometimes the circulators will kind of hold your mask for you while you're grabbing your medication to induce. And I started being, super nerdy, and I'm like, well, your job is really important. You have to make sure you have a proper seal. And I show them the fucking ventilator. I'm like, I want to see good tidal volumes. And I'm like, make it simple. I'm like, I want to see that green line right here. And it needs to be really high, has to be more than 300. And then you're doing a good job, So, and they actually really appreciate it and stuff like that. So I get them as involved as much as possible while I'm, providing anesthesia. Ask them, hey, can you please put in an IV for me? All this helps us. So, but yeah, a good circulator connects to the patient, to the monitor, helps me, putting in an IV is fucking amazing, so I can focus on the patient, do my other things. And
Yeah, I want to know too.
Yeah.
Do circulators think we're annoying? So the other day I had a.
I've kind of heard a little bit. Yeah.
No. You didn't let me finish. I mean, there's multiple reasons why. Yes, they do. But so just like you were talking about teaching your circulators, I had a patient spasm on me when I was doing a colonoscopy the other day.
Oh,
And I looked at the endo nurse and I'm like, hey, come look at this. You want to see what a laryngospasm looks like? Like as I was treating it, but still I was like, look. And you could just see her like swallowing. And I'm like, yeah, she's laryngospasming. So that's what's happening. And I'm like, so this is what I mean when I tell you, hey, I need this, because the patient's like not doing well. She was like, oh, I always hear you guys talk about that, but I haven't seen it. Like now I can see it. And then I explained to her like what was happening.
I think too. Like,
And I was like, I don't know if she thinks like, hey, I don't fucking care. That's your job.
You hope
She's
so.
what want me
right,
to do.
looking at you, she's like,
She's
figure that shit out,
all
bud.
right, bro, I'm charting. Like you just interrupted my charting. Now I got to
Right.
catch up. Or like, oh, thank you. Like, I don't know if she's
But that
being polite.
relationship is so important because you
Oh.
had a patient. I think you were a student that you had to re-intubate, but you were like you couldn't really take your hands off there, right? You were
Yeah.
trying to get your tube ready, and you were like, pull up this drug.
So that was my first reintubation ever. I extubated a patient and he was pulling great tidal volumes. Like his minute ventilation was like 15. So he was mechanics looked
Yeah.
great.
Yeah.
Pulled the LMA. I mean, he was a bigger guy, but extubated him and immediately just started desatting. And my preceptor was like, go get albuterol. And I think I'd been a SRNA for like 2 months. Like I'm 2 months into clinical. Like I'm brand new.
You're like albuterol.
So I'm terrified.
But also in sites, you don't really know where.
No,
everything
so
is.
I
Like, you need a
didn't-
special adapter. And
Yeah,
all
this
that.
place didn't just have like a MDI that you could puff down the tube. Like it was only the nebulizer.
Yeah,
So I didn't know.
syringe.
Well, I didn't know where to
pop it
get
in.
the circuit connector for whatever. So I ran out of the room. I came back in, and his sats were like in the 80s. So my preceptor's like, I'll go get it. She runs, but the time that she was out of the room, he went from like 80 to 40 in like a minute. So I told the
Jesus, take the wheel.
I told the circulator, because I was holding positive pressure, just PEEP and like helping assist ventilate. I'm like, we're reintubating. Get me a tube. put that in there, and
Yeah, because I don't extubate with another tube ready to go.
Yeah, yeah.
No.
Yeah, no.
So that I was just like,
The
I
other
need you.
tube's in the trash. That's right.
So I was like, you pull up propofol. So I'm just like telling all these like scrub techs and everybody, I'm like, you grab this, grab this, grab this. And I re-intubated, and I was terrified that my CRNA was going to be so pissed at me because like she wasn't there.
Yeah.
But she was like, thank fuck you did.
Well, I
Yeah.
think the
But it was like-
anesthesiologist walked in right as you were doing it. She's like, good, yeah, go.
Yeah,
let's do
like
it.
I was DL, like the blade was in and I was passing the tube.
Oh, well.
Turns out you don't need meds if they're that low. You don't have to ask for
Yeah.
propofol when their sats are
Those
40.
fucking cords are
Yeah,
very,
they're
very
open.
like, help me, bro. Put
Yeah.
this. Yeah, yeah.
So, but having a competent team,
Yes.
No,
very
but, like,
important.
That's my biggest pet
You
peeve.
know,
When they're
and
just
it-
sitting there watching you, and I'm like,
oh, but yeah, or if the patient's waking up and they're like rolling off the
Yeah,
bed,
yeah,
I'm like,
they're
can
just
someone
watching.
please like come help?
Yeah. This team was like on it, and they're like, how can I help you? But I would have hated to be in that situation with some other.
Yeah, I think too though. Like I actually learned over the years is that when you have a team, you know, communication is key. So you know, there's times that I will communicate as much as I can. I try to, especially I build a rapport with some of these nurses in certain areas. If I'm in GI, and you know, I can't do everything, especially when they're dropping from fucking 100 to fucking 7. It's scary, right? So, you know, showing them like, hey, even though you're here every fucking day, this is where the ambu bag is, just in case if I need it. Because there were times, you know how fucking endo is. Endo is you push a little bit of propofol and then they stop breathing, and then again they're 100, and then now they're satting at like, you know, 0. So and it's scary, and then the doc is looking at you and he's freaking the fuck out.
We
Doesn't
have a
know what
good
he's doing
endo
with
team,
the
though.
Yeah,
Our
they
endo-
are.
our
Yeah,
endo
our
team
endo's
is
good.
very
but it's I
helpful.
think it's like how we're talking about. It's good to have a really a strong team to
For
to,
So
sure.
you only have
to be
2
there.
hands at the end, and if you need to hold that airway open,
Exactly.
if you let go, you know, sometimes
Yeah,
just
you
need help.
literally when you're talking about the case that I came back for a break earlier.
Yeah.
That was actually, we had one of the nurses, or it was, I think the scrub tech was asking, she's like, why are you guys like looking at the patient and then looking back at the ventilator while we were extubating? And I kind of walked her through. I'm like, well, this
Why?
is what we're looking for. Because that
Why
guy,
you look at the
Yeah,
patient
yeah,
so
like-
much?
Yeah.
well, she's like,
Why
what
are you
are,
so concerned? What are you looking at?
yeah, she's like, what are you looking on the ventilator? And I just told her like, oh, I want to see how, like, are they taking a big enough breath and everything?
Yeah.
They just assume like when you're about to extubate, it's done. Like
Yeah.
patient's good. We're gonna
Yeah,
get
the
out of
patient's
here.
done. Like, we're already take the
But
tube out. I'm
no.
like, no, they have to
This
be
is like the
doing
time where
things.
shit can happen.
Yeah. And then I think it's, again, it goes back to communicating and teaching. I think teaching them to show actually our job is not, they think we just sit there and do shit. You know, our job is actually very difficult, and our job is very serious. So I like any opportunity that I have to actually teach them, you know, from circulator to surgeon to, you know, the environmental. I like to actually show them like, this is what we look at, you know, this is the most important thing. And that's pretty much it. So
Yeah, we got a whiny dog that we're gonna shut up right now.
she's hungry.
Yep. She doesn't matter.
Chippy.
Yeah.
Chippy. But yeah,
All right,
so
Mama's going to get the whining dog.
but yeah, so yeah, I don't know. I you know, there's a lot when it comes to circulator. I think it's really important, you know, just overall just being helpful and
Yeah.
and helping us.
So if a circulator's out there watching,
yes,
let us know what's annoying about CRNAs. I want
which
to
is
know.
which is nothing,
They'd
honestly.
be like, hook up your own patient.
Because
Yeah.
anesthesia,
Put your
us
own
in
patient
anesthesia,
on
we're the
monitors.
fucking best. You can say
What's
it.
a trait you hate about us?
We're bossy.
I want to hear it.
Nothing.
So what I have started doing recently, which I learned from this old ass CRNA,
Emmis?
let's call him Emmis,
Emis.
is bring your own speaker because we don't have to listen to shitty music.
True.
So I started bringing my own speaker, and I just put the music on before
Do you put
other
like
people.
hardcore fucking metal?
I don't, but I should.
You should.
Oh,
So
no.
like, I got called in the
Hell
other day,
yeah.
and I put Creed on because I wanted to listen to Creed. So we went to sleep listening to Creed.
You said try and stop me 6
Yeah.
feet from the edge.
Yeah, dude.
Don't play that while they're going to sleep.
That's a good point. I didn't think about
Like
that.
so far down.
No, it was 11. It was like 11 at night. I got called in. I'm like, I'm fucking listening to music while we're going to sleep.
I like to
Yeah.
sing my patients to sleep.
Yeah,
we talked about
terribly.
this before.
They don't
no.
like it.
Oh, they love it. I'm like,
You and have horrendous voices.
oh no.
Aruba, Jamaica.
Go, I wanna take ya. Wait, Bermuda, Bahama, come on, pretty mama.
So it's obviously really great when you have like a good team, but
Yes.
let's talk about like some of the things that are like the worst when you're a CRNA. For me, it's no matter what I give, I can give all the Prestex in the world. You give Dilaudid. For some reason, some patients just still wake up like alligator death rolling in the bed.
Fibromyalgia. Those patients that have like
They-
42 fucking allergies and
Yes.
it's fibromyalgia, those you can never please. Never.
Yeah.
Fucking please. Oh, yeah. But this one time actually happened when I was a SRNA, which is the reason why I don't like to really use a lot of ketamine. So, long story short, I was doing a MAC and I had a propofol. And me trying to be a good SRNA, I was like, oh, let me not waste propofol. It was like 10 minutes left and I was like being super nerdy. I was like, the half-life of ketamine, blah, 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 all this bullshit. CRNA was really nice. She's
Nerd.
like, do whatever the fuck you want. She was super sweet. So I was like, cool. So I grabbed ketamine, give the patient some ketamine. Patient chills the fuck out. Procedure's over fucking 5 minutes later. Patient fucking starts
K-hole.
waking up. Oh my God. Eyes black. And I was like, hey, how do you feel? And she's like, wow, so many colors. And I was like, oh shit. And I was like, okay, we're good. And I was like, oh, okay. You just had surgery. She's like, I was on a rocket ship. I was flying. And I was like, oh,
She was like, that was some good anesthesia.
okay. I was like, are you okay? And then
That
she
was
just
some SRNA anesthesia. Giving ketamine at the end of the case.
I'm
and
seeing
she-
colors.
Great idea.
she's like, she's fucking busted out crying. And I was like, fuck, what do I do? Should I give her some Versed this year? And it was like, no, this is an outpatient center. I was like, fuck. So I just wrote the patient
Like,
out.
snap out of it.
I rolled the patient out of PACU and I rolled it to PACU and I dropped the patient off. I look at the PACU nurse. I'm like, I'm so sorry. I'm so fucking sorry. And she's like, you gave her ketamine. I'm like, yeah, I'm sorry.
Yeah,
Like,
I didn't just give her ketamine. I gave it to her 5 minutes ago.
I'm like, good luck for the next 30, 45 minutes if you're fucking watching her.
Expect another case. Bye.
Oh, my phone goes off. I'm sorry. Nothing goes off.
Yeah, some patients like wake up emotional from Versed.
Oh, yeah.
Like all that.
Yeah.
Just like young women, I feel like in general wake up emotional.
Yeah, you're just emotional before you go to sleep. You're emotional when you wake up from sleep.
Listen, sometimes patients, when they wake up and they cry, and I'm like, I know, boo. I'm like, my fucking anesthesia is pretty nice, right? And they're like, ugh, but they're probably
Because they
crying
won't be in
because
pain. They're like, are you in pain? They're like,
I'm like, are you sure?
Well,
That shit sucked.
well, I never had an experience with ketamine before, but I've had an experience where a patient did wake up crying. But like, I don't know if I should say it though. But
Do it.
well, I mean, now's the time.
okay. So it wasn't ketamine. So it was a GYN case. I haven't said the story since it happened. It's been a while, but it was I'm pretty sure it was a hysteroscopy, something like that. Very simple case. LMA, whatever. Propofol, lidocaine, some fentanyl. And she wakes up crying, and I go up to her. I'm like, "Are you in pain? Are you okay?" And she's like, "No, I don't know how to explain it, but do you know what BDSM is?" And I was like, "Yeah,
Interesting.
okay. Are you in pain?" Like, okay,
But are you in
but
pain?
are you in pain? I'm like, okay. And she was like, no, I'm okay. I'm like, all right, whatever. So I walk away. Sometime later, a nurse comes up to me. The nurse that was taking care of her comes up to me in the lounge. She's like, Stephanie, what does the patient have? What was she telling you that she has? She told you something. Like, I don't know what that is. Like, what was it again? I'm like, it's not that she has this.
You're like, you don't know what that is?
It's like, I don't know if you want to know. I think you're better off not knowing what she was talking about. But I was like, she mentioned BDSM. She's like, oh, what is that? I'm like, something sexual.
Yeah.
That she does, that she enjoys. But she's not in pain. She told me she said that
likes
she was
pain.
basically she's
she
having
loves
pleasure. And then the nurse goes, oh, okay, yeah, because she says she's not in pain and she can't describe what she's feeling, and she's feeling it down there. I was like, yeah.
Stephanie out here giving patients.
So-
A free orgasm.
So Stephanie made a patient.
I should have charged her extra for that.
You're fucking talented,
So
babe.
I'm
I
here
see
like,
You gotta
it.
know
oh,
your
like not
recipe.
giving ketamine at the end.
Right?
I gave a
Imagine
little
every-
sprinkle of fentanyl because it was a quick case, but apparently she had pain in the right places.
It's the
Yeah.
it's the anesthesia touch you got there. Teach
Yeah.
us.
Well, I don't
Teach
think we can top that.
I-
So
I
I think
can't
we're
top
going to
that.
wrap it up. Leave us a comment if you've ever made your patient. I'm just kidding.
Can you make your patient?
She sure can. I'll tell you that.
I never have.
If you're not
was the first for
subscribed,
me.
Not that good, bro. I'm not that good.
make sure you hit the subscribe button, give us a thumbs up, leave a comment on anything you want us, talking about, and we'll see you next time.
Hope you enjoyed.
Bye.
Bye.